So today, I am not talking about anything about the imaging. I am not talking about any nuclear emergency. I am talking only for the radiation emergency, for the handling of the radioactive material in this. And
Shivanand, welcome.
Yes, sir.
Good evening, everybody. Today's session is very important because basically it is related to nuclear medicine, but it can impact anybody. The nuclear radiation safety we have to understand, and we have to learn some basics. That is what Shivanand is going to talk about. He said that it is a very core topic, so how would it be useful to the community? But these are some of the things which are important as a human being, as a person, you should be knowing, and as a medical, you have more responsibility in such a disaster. If something happens, what to do and what not to do, it is very important.
Yes.
So welcome, Dr. Shivanand. He is a nuclear medicine specialist, and he has spared some time today for us. Thank you so much, sir, and you will be enlightening all of us. The stage is all yours.
Good evening to all my friends of Doctorpreneur Academy. Myself is Dr. Shivanand Bhushan. Myself has done the PhD and working as a faculty here in the Manipal Academy of Higher Education in nuclear medicine. I started my career in 1989 in nuclear medicine from Sanjay Gandhi PGI MS Lucknow, where I set up the nuclear medicine. Myself is the radiological safety officer in nuclear medicine and teacher for the radiation safety. So I am working as then after that I moved to the Bhava Atomic Research Center, Mumbai, and Tata Memorial Hospital, Mumbai, worked there, came back to again Lucknow, and then shifted and setting up the nuclear medicine center at Indira Gandhi Institute Medical Sciences, Patna. I shifted 2009 here in Manipal Academy of Higher Education as a faculty. Since 1989, I am in the nuclear medicine, and last 20 years, I am radiological safety officer in nuclear medicine. Looking after for that, I have done my fellowship in the Mahe Femur fellowship on the radiation emergency preparedness. I started this journey actually with to become an entrepreneur. So my journey motivated by my mentor, Doctorpreneur, and Mr. Amit Singh Moga, and he motivated, and certainly I started journey. I have incubated one in the incubator company, and then I started with a small device which we are trying to develop, and then planning for going for the more for the consultation services and those things. So today's session is related to the nuclear medicine radiation safety. It is different radiations. They are the radiation professionals, those who are working as an expert in the radiology, radiotherapy, that means as the radiation oncology and nuclear medicine. So these are all called as radiation professionals. So I'm just trying to share my screen. Today's topic I have taken as a radiation emergency, which was started radiation emergency preparedness and response management. So this is the radiation emergency prepared. Before going to this, we have to actually, whenever the emergency comes, before that we have to handle the radiation. So in the nuclear medicine, how it differs from radiology. In the radiology, the radiation which is used is the X-ray, and here we use the gamma, beta, and alpha radiations. So gamma radiations are the nuclear origin, whereas the X-ray is extra nuclear radiation. So in this way, that radiology practice and the nuclear medicine practice differs. We use the materials which are emitting the gamma radiations. These are used for the diagnostic purposes, for the imaging purposes. And there are the beta particles and the alpha particles. These are also emits from the nucleus, which are used for the therapy purposes. So nuclear medicine is not only the medical imaging, it is for the therapeutic also. So we are using for the diagnostic as well as therapeutics. Nowadays, there are the radioisotopes and radiopharmaceuticals are available, which is used as a theranostics, which can be used for mainly for the therapy, and then further it can be used for the diagnostic for the follow-up to do. So these are the radiations, are the gamma radiations, alpha and beta. All are radiations are harmful, but nothing to worry for this. If you are handling with the care, that's what we say always, handle the radiation with care without any fear. If you have radiation phobia, then it is difficult because we are all staying wherever we stay at the home. That also is full with the radiation. And when we fly in the flight, there also we get the radiation, nothing to worry for that. But it has to be handled very carefully. So nuclear medicine is using with the gamma radiation. Nowadays, fusion modality has also come for the imaging purposes, where we use gamma radiation for creating the nuclear images and fusing with the X-ray in the CT scan. And then it is the called as an SPECT CT facility, or it is the PET CT facility. So today I am not talking about anything about the imaging. I am not talking about any nuclear emergency. I am talking only for the radiation emergency, for the handling of the radioactive material in this. And in this, again, in that, I am not touching the part of the medical radiation emergency. So here is what we are talking about, the radioactive materials handling, and due to that, any untowardness and the mishappening, if it occurs, that has to how to get it handled with the radiation. So the contents are adopted from the quoted sources for creating the awareness among the learners to design, develop future-ready, effective collaboration among the emergency response team and the facility owners. They also should be aware, because they are the responsible for the nuclear radiation emergency situation in the hospital settings, because these are all controlled by the AERB, Atomic Energy Regulatory Board, for the handling, as well as NABH. Under the NABH also it controls. So we will familiarize with the few terminology which is used in radiation emergency. We'll learn about the radiation emergency response team. These are how this team work in the cohesively. It works in the nuclear medicine. Good radiation protection practices for the handling as a radiation emergency preparedness, the few case scenario in nuclear medicine and their preventive measures and response management. We'll learn about the emphasis on various key insights on the radiation emergency preparedness, response management by nuclear medicine facility owner or the hospital owners. They should be aware how they will manage and gives the cohesive, or they can manage their own staff and the department as a radiation safety culture, because that is the part which has to be maintained. Good radiation safety culture to maintain is the responsibility of the hospital owner, hospital managers, and as well as for the facility owners. So are we ready, guys? So we can start with this now. You identify, anyone, identify from the left to right in the horizontal row if you go. Which one sign is the nuclear medicine sign? These 15 signs are available. So this is the actually sign which is the having foil structure, three-leaf structure with the center. So nucleus in the center, in this is nucleus, from where the radiations are coming, alpha, beta, gamma. Three leaves are there, and you can see that this is the sign of the radioactive material, radiations, nuclear energy sign. And we use in the nuclear medicine. These are the different signs you may be seeing. All the different signs for the different symbols are there. So these symbols for the radiation area, where it is written caution signs, you must be seeing this type of labels in the department, wherever the areas are there. This is the high radiation area. This is for the radioactive material. Because you know the radiation nuclear energy can exist in the solid, liquid, gas, all the form. So this can be the gaseous forms also are used, like for the lung ventilation imaging and those things. So airborne radioactivity area, if it is there. Radioactive materials, any materials are there. So when it is going for transportation, so we have to make a different sign. It's a written, see here 7. This is the hazardous material sign. Wherever this symbols in the lorry, container, or in the any place where the materials we are keeping in the storage area, we can show this type of symbols are there, and it's showing the low hazard level to high hazard level. So 1, 2, 3 is the type 1, type 2, type 3 radioactive material. The first is the white type, level is the yellow, and third is also yellow. Third is very high amount of activity. If it is transferring or transporting, that time we have to use this type of symbol. And if you see anywhere this type of symbol, if you try to understand, this is the radioactive having the nuclear energy. So be cautious for that. So nothing to worry, but we have to, because here the some radiation level also maybe they will write that's called transport index. And the symbol is called as where we use nuclear energy as well X-ray. Is the fusion modality when we use like SPECT-CT, PET-CT, this type of things are nowadays we have started using. So this type of, we have to have a symbol when the X-ray radiation and this thing both has to be there. So these different type of sign and symbols at different places to use is the first step of our preparedness. We know and appropriately to use. New terminology like nuclear radiation, as I already said, this is the radiation which is coming out from the nucleus is called as a nuclear radiation. That's why it's a nuclear energy. Okay, so this energy, like because the radiation is nothing but energy in the transit. And there's another terminology we use is the most frequently is the emergency. All the emergencies are the untoward happening, risky hazardous mishaps or events are their consequences. And that can be minimized. How to get it minimized is your preparedness. Readiness toward the emergency is the emergency preparedness. We have to see good plan, make you the good preparedness, and good preparedness makes us that mishap should not happen. So that means we have to learn about the good practices of the radiation protection. This is called response. So bringing knowledge and skills learned in the real actions once we are taking some actions is called as a response. So the response terminology has to be get used there. Management is the good radiation protection practices, radiation safety culture, or you can say the 4 P's management. If these are all having to get combinedly to get managed. So this is the management accidents and the incidents. These are the 2 different terminologies we've used. Mostly in the nuclear medicine, actually, we are not finding more than that. There is based on the hazardous level scale, that's called, this scale is called INES scale, International Nuclear Event Scale. It is the scale from the hazard, it is nothing is there, so it is called as a 0. That level is scale is 0. And as this is going to impact as it is increasing to the high level, goes up to 7. So mostly the nuclear medicine falls under this category, incidents, because these are the controlled for the medical applications. So these are the mostly chances are the incidents can happen, but still we have to be very careful. Accidents usually occurs where the accidents can impact to the public and the environment and the persons who are around them. Then it is called as an accident. The scale of INES, it goes from 0.3 to 0.7, high scale that we will see now in the next slide. Emergency plan, and these are the nothing but set of procedures to be get implemented in the event of accident or mishap. Emergency response arrangements, the integrated set of infrastructural elements. That's why we come as an hospital owner. We have to see what are the infrastructural elements that has to be built, the planning of nuclear medicine, where to site, how to make this thing. These all arrangements, hospital owners also should be aware of these things because these are going to be consequences can occur in the future. So that's what all these things in response, the arrangement, emergency response arrangements, that's called preparedness, should be known about not only for the siting, but the personals, plans, procedures, facilities, equipment, and the persons who are all working for them to train them. So that's why these all things comes under the emergency response arrangements. And with the facility owner or the hospital managers, or you can say the hospital owners, they should be aware of all these things. Radioactive contamination terminology is very frequently used. It is the undesired presence of the radioactive material. Okay, it can be the loose or fixed type. It can be the external or the internal. That means the radioactive material, it can, as I told, it can exist in the solid, liquid, or gaseous state. So mostly in the nuclear medicine, the radiopharmaceutical for the imaging, when we use, these are in the liquid form mostly. So this is the injectable to make, or the oral can be. It can be administered through any route. Okay, different type depending on their utility. Actually, based on that, the radiopharmaceuticals are used. So we have to very cautious when it is the gaseous. So this should be very much controlled way to use, because gaseous leakage, if it is there, it can contaminate to the entire laboratory environment, and it will get inhaled. So that will cause the internal contamination to the persons around, working around, and as well as to the others, the patient carer and those things, those who are around, the other staffs and other hospital staffs, those who are not the radiation professional. So that can cause the internal contaminations. So if there is a risk is there to handle. Certainly it has to be get handled with the care. If it occurs, anything occurs during the work, should be get reduced or removed. That is called as decontamination. And the any radioactivity material, if it is oozing out from some container or their body, like it can come out from syringe, pipette, glass vial, test tube, columns, or the patient once if you have administered and it's vomiting. So that also can cause the spillage, or the patient is micturating. So that will also cause the spillage. So these type of radioactive spillage can create the different type of emergency scenarios if it is in the large amount. If it is a small amount, then it is called as contamination. And this contamination, so that's what in the radiation safety protection, we have to be very aware of those things. Another terminology used is the radiopharmaceutical misadministration. Misadministration is the wrong dose to the wrong persons through the wrong route of administration. If the route is wrong, or the pregnant ladies, that when we have to always be cautious, because that if it is in the reproductive age of group of the patients, we have to be very cautious for that, have to ask always, and then only to administer or to use the nuclear. That's why there is the basic principle. We will see in the next slide what is the philosophy we use for the radiation protection. Handling of the radioactive materials, it can be used for the manufacturing. Possessing the facility is the responsibility of the owner, facility owner. Safety and security, that should be get included there. The storage, uses, transfer, port or import or transportation of any radioactive material, or their safe waste disposal. These all are called as an handling of radioactive material. So there is another radiations are there, which is emitting the quantity of radiation, use the terminology as the dose. So it is measured in the millicurie or the megabecquerel. The unit is curie actually. So it can be the millicurie or the microcurie. Dose rates, radiation dose per unit time is the MR per hour. The instrument which is used for the measurements are either called as a dosimeter. It can be the personal dosimeter. It can be the survey meter, like different type of radiation devices are there for the radiation monitoring for the exposures of the persons, or the contamination level or spillage has to be get checked. There's a documentation, certainly all the parts are there when we have to get document for the keeping as an evidence. So recorded or pictorial information describing, defining, specifying the reporting or certifying activities in the requirements or the procedures or the results. So these are all the documentation we use in the radiation protection or the radiation safety or the radiation emergency also. Like it can be the standard instructions or the operational control procedure, OCP, the standard operating procedures, checklists, radiation safety manual. These are the special documentation which has to be kept here actually. And then another term of emergency exercise. These are the test of emergency plan. Once you have to plan and how to get it coordinate among the many interfacing components, and then it will be called, it can be the simulated or it can be that series of events in the plant which has to be get. So these are the emergency exercises. Sometimes it is also called as mock drills or the simulation exercises. There is the International Nuclear Event Scale, NES, based on the severity of incidences. There is the competent authority. This is the terminology which is used. So here the competent authority for India is the Atomic Energy Regulatory Board, AERB, is the national authority, comes under the Department of Atomic Energy, directly controlled by the Prime Minister's office, PMO office. So because there is no department, like a Department of Atomic Energy, there is no ministry. So it controls under the Atomic Energy Regulatory Board, which is the independent under the government of defense in depth. It is the security, the concept used to design the physical protection of the system of facility or the radioactive material to overcome that any obstacles or any diverse things should not happen in this. So if we are looking into this, so it's called defense in depth, that is the security. So the radiation protection. So this is the radiation protection. The P word is called as an keyword for here. 3P, I always say, one has to get, whenever we are going to handle the radiation, we have to plan appropriately, get it prepared for this, and then to start mock practice, simulated practice to do, then only to perform and proceed to perform. This 3P is the very important key: plan, prepare, and practice. If 3P you are following, that means certainly you are going to follow the good radiation protection practices. There is another other keys are also there which we have to follow. Like for radiation safety, we talk about, or radiation protection, we talk about for whom. This is for the 4 P's, the safety requirement. P is the patient first, where we have to make the patient safety. The radioactive materials we are going to administer, but how much it is safe, that has to be get checked. Okay, it should not be get misadministered. So patient safety is the most important. And next is the professional, the person who are all working, the nuclear medicine professionals. It can be the physician, technologist, physicist, chemist, radiochemist, radiation safety officers. All these are the college and nuclear medicine professionals. So these professionals should be get safe. Then we are save the public. That because suppose whatever we are using, it's going to the public or around. So they should not get exposed, radiation exposure. If it is that due to the contamination or the spillage, if it is going to spread contamination, they can ingest or inhale or absorb through the skin. So public also can get affected. So public safety is also part. Then the product which we are preparing, like radiopharmaceuticals, which we are going to administer, it should be very, very safe. So pharmaceutical product. So 4P, the patient, professional, public, and pharmaceutical product. So 4P is the radiation safety for whom we are trying to keep our protection. Next is the 2E to remember. That is the equipment and environment. The equipment, the devices, instruments, whatever we are using for the radiation measurement, radiation cannot be seen. So we have to have a radiation sensors. So these equipment, once we are using that for the contamination detector, survey meter, dosimeter, or the gamma camera, whatever the equipment, these equipment should not get contaminated. So we have to avoid those contamination, should not there. So we have to protect our equipment. If equipment is contaminated, that means it cannot measure our appropriate radiation. So that's why equipment protection is the very, very important part. So that has to be get taken care. So if you are following, protecting the equipment means all the quantitation or the images will be in quite precise way. We can diagnose or we can give the therapy, and their dosimetry can be done very properly. Next, not only the next E is the environment. There is the 2 type of environment one is the controlled environment inside the nuclear medicine. That is called laboratory working environment, where we have to handle the radioactive material very safely with that, and so that it should not get spread, it should not get spill, and then we have to, or anything should not get break, that radioactive containers and those things. So we have to control is the inside the laboratory controlled premises. That's why these are the restricted entry. Those persons who are allowed to work in the area, they only are going, or the patients are in the limited area, their movements are there. So next is whatever the radioactive materials we are using, these are the administering to the patients. They are excreting the urine, fecal matter, and their sweat. So these are coming out, or the waste material when it is coming, which is going to our environment. It is causing to the ecological toxicity can cause, radiotoxicity can cause. So we have to save the environment also. So 2E is also most important for the radiation safety. The radiation safety cardinal principles, what we know, most of the people, those who are from radiology or the radiotherapy, radiation oncology, they know the radiation safety principle as called an TDS formula. That TDS principle, time, distance, and shielding. But this is not true with the nuclear medicine. Many people are having the myth. So this is actually the TDS and A. That is called activity. Activity is nothing but radioactivity, amount of activity, what we are going to handle. So that is the cardinal principle. We have to manage minimum time before the radiation, so that radiation exposure will be less. And the distance has to be get far. It is the inverse square law, it follows. So and then shielding, if the radiation source and between the object or the person who is there, we can use some shielding material in between. That mostly shielding materials are the lead. So we use based on that only in the hospital. Mostly people are using either lead shield barrier. So we use the L bench and the lead shield barrier mostly in the nuclear medicine, or when the radiations are very high, then only use the lead apron, because lead aprons are very heavy and it causes the occupational diseases more and more, like blue MST diseases, related musculoskeletal disorders. So that's why lead aprons are not much used in nuclear medicine, because everywhere radiations are present. So whenever we use CT scan in the SPECT CT, that time lead apron can be used. Activity is the amount of activity. We have to take care for this. That means the small drop of activity can contain the very small amount of nanocurie of activity, whereas the same drop can contain the curie of activity. So that's why it is the safety cardinal principle. We have to consider the amount of activity. So based on that, the risk and hazard evaluation has to be get done. And that amount of activity, if it is radiation concentrations are very high, we have to be cautious. So that's why time, distance, shielding, and activity. It is differs from the radiology, TDS, or the radiation oncology, what they use in the radiation science. This is the philosophy what I was talking about. Here is the justification, optimization, and limitation. This is given by the ICRP. ICRP is the one of the International Commission of the Radiological Protection, and it is given in the July 2020. The justification means all the work, the operation, whatever we do, during the handling of radioactive material, should we have the justification why we do this work. Okay, and whenever we do the patient study, that also is this time should be justified. Like I was talking about the patient, for the pregnant patient, we have, if it is there, and then we have to justify the risk versus benefit, and then to use. This is called justification. Optimization of the protection has to be get done. It has always to use as an optimal dose to be get used, so that it should be safe for the persons or the patients where we are using. Limitation is the whenever we want to minimize this radiation. This is called LRA, as low as reasonably achievable. So whatever, even though a small amount of activity is there, which may not cause much radiation, but still we have to follow the LRA principle further to reduce. That's called minimization. So because based on that, it has to be get limitations to be get applied. So this is the basic philosophy of the radiological safety. So these are the time, distance, shielding, and activity. Justification, optimization, and limitation is the philosophy where we all follow. And if we are following, so certainly we can overcome any mishappening. If it happens, we can able to handle these things if we know this all the basic things. These are the protective tools which we use, and which we use, that is the barrier, radiation barrier, to protect our eyes during the handling of radioactive material, which is used in the radiopharmacy laboratory. We always use long tongues, long forceps, and these things are for the distance to maintain that, so that radiation exposure to the person who are handling should get the less activity. Screen shield we are using as a shielding. So this is the all shielding, so that finger dose, extremity duration dose will be less. Although limit for the extremities are very high, but still we have to save our extremities, hands, fingers, and those things it can use. So based on that, the different type of shielding materials also we are using. For the waste container, operated beans to use, protective aprons, protective gloves, syringes. These are the, you can see, these are the long tools. Handling of the vials, which is radiopharmaceutical, is there in that vial. We have to handle the long tubes. Long is for the distance principle, which is used. And distance shielding. So D is maintaining here. And this is the shielding. And the skill that will maintain the time. So we have to do the work with the fast way. That is the reason, another reason why the lead apron is not used in nuclear medicine mostly. We use only when there is either any accident happens or it is the very high amount of activity is there, then only we are using the lead aprons in the day-to-day practice. We are keeping in the rate at the preparedness. We have to keep lead aprons in the, because this is also one of the requirement. If any NABH will come, they will ask you that whether the lead apron do you have or not. And this has to be get checked. Lead aprons to be get checked at least once in a 6 month. That is called half yearly. So half yearly testing has to be get done for the crack of this thing, has to get stored in the hanger, not in the folding way. So these are the things has to keep, because the NABH, or suppose you are the hospital owner, you are the auditor, you will go to some department, you can ask those things. Do you have this type of tools? Do you have this type of this thing? So it can be very useful for everyone, and for the even manager, auditor, inspectors, that they can ask. Good practices for the preventing the mishaps are the do's and don'ts, what we follow. And don't enter the restricted area without the permission. Don't eat or drink or smoke in the laboratory. Do not prepare any radioactive material in the mouth. Do not share your TLD. TLD is the thermoluminescent dosimeter for the measurement of the radiation dose to the body, how much it is absorbed. These TLDs are mostly used for the occupational workers only. Okay. These are there are the like trainees category and the worker category, different type of TLD. There are the TLD which is used in the wrist also. In the nuclear medicine, we use extra TLD for the extremity dose to measure. Whereas in the radiology or the radiation therapy, we use only the STLD. So this is the difference between the radiology and radiotherapy radiation safety practices. Nuclear medicine safety practices are entirely different from the radiology and the radiotherapy. So here is the do not leave the TLD in the radiation area because unnecessary exposure will be there. So whenever these are the things as an auditor also, if you are going to the department to visit and to inspect, you can see that where they are storing, whether this should be kept in the low background area where the radiation levels are not there, or it is very minimal radiation exposures are there. So it should not be near the direct sunlight also, it should not be kept. So this should be always stored in the proper place, and the people should not share the TLD. Sometimes they say that, okay, it looks like TLD the same, they're wearing, someone else is wearing for that. But it is the personal, so it is the personal dosimeter. These are all things what we follow as a good practices. If we follow these practices, we are preventing mishaps will not happen. So that means we have to transport the radioactive material in the lead container. We have to wear the TLD in the working radiation laboratory. Our principle has to be followed. Under the volatile material inside the fume hood, because it is the gaseous thing will come out like iodine 131, which we used in and out. It is the for the any whole body iodine scan to do, thyroid scans to do, or it can be for the therapy, toxicosis therapy to do, for the high dose radioactive therapy for the thyroid cancers to do. So these iodine always to handle inside the fume hood. If you follow, so that means there will be no mishap. And this fume hood should be in working condition. That also is very important. All the instruments should be in the working condition. All the work surface area should be covered with absorbent plastic sheet. So these are the do's and don'ts what we follow in our department and in any nuclear medicine department. So don't transport the radioactive material outside premises. These are not allowed by the ARB. It should be whenever it is transporting the radioactive material from the supplier or the manufacturers to that, it is follow the transport radioactive rule. And then be with the trim card, and those things should be get used on the vehicle. Then only it should be get transferred. But once it is reached, it should be from the premises, should not be get transferred, should not be get sell or to any other lab or the other centers. People are doing like this. This is all the can count. If anything happens during that, it will be the very serious issues. So this is the radiation protection. What I say, the three keyword again to remember. Whatever the work we are doing, we have to maintain the quality, safety, and security. These three things are the radiation protection practices, good radiation protection practices keywords. If you are following, so certainly that untoward event will not occur in your department. So only thing, if it is occurring, what is the radiological impact if it is having in any untoward events are happening from the regular protocols and those things has to be get minimized. What we have to, for that we have to get prepared, and response actions has to be get taken. So that's what we are getting ready. So we have to get prepared for those things. This plan, we have to expect that what are the things, what are our work protocols are there, and where it can go wrong. If anything goes wrong, what we will do. So these are the called response actions to take. There are the two types of emergency can occur. It can be the incidental or accidental. Accidental cases are very rare actually. It is during the transportation can occur that it can get damaged, or due to the building collapse or any natural disaster it happens, then only the accident can occur. Otherwise, mostly in the nuclear medicine practices, incident only can happen. And that is also the level is from 0 to 3. Level from 0 to 3 level only. A 3 level INES scale, 3 to 7 are the accidental scales. Or it can happen the intentional act for the radiological sabotage to do, or it can nuclear terrorism. So these are the different type of emergencies are there. Nuclear terrorism not related to nuclear medicine as such. It is the nuclear power plants or the nuclear reactor, or sometimes they can do some with them. So it is the intentional if they are doing someone is doing the terrorist activity. Radiation emergency can pose the immediate health risk because it can get ingested, it can go through the absorption, skin absorption also it can go inside the body, and then it can cause the radiation hazard to inside the body. Contamination and spills these are the activity which can cause the internal hazard. This is the International Nuclear Event Scale, INES level scale, which was given in 1990, effective from the 1st July 2008, given by the IAEA, called as an International Atomic Energy Agency. So it is the worldwide it is used. So these are the zero level, no safety significance, below scale 0. Level 1, 2, 3, this is up to here, only the nuclear medicine risks are there. Whatever radiation emergency we are handling up to level 3. More than that is the accident, maybe because of the natural disaster or the building that thing, because of that it can occur for the nuclear medicine. Or from 4 to 7, like Fukushima happened. That was the level 7. It was the major accident happened. 3 Mile Island, these are the different accidents happened. Those things were actually having the nuclear accidents. But now, since there is the nuclear age and India is moving towards, so we have to get prepared for the radiation emergency, and everyone should be aware. So risk assessment as a manager, hospital manager, facility owner, as a hospital entrepreneur, one has to first, whenever you are thinking for the planning or this risk assessment, and the planning has to be get done if you are going to establish the radiation facility, especially the nuclear medicine. So that means you have to identify the risks, what are the risks are there, the appropriate emergency protocol has to be get prepared, and has to be get prepared with the help of radiation safety officer who is there in that, because they are the only can help you in all the aspects. The scenario planning has to be get created for that, so that the mock drills can be get shown to the persons and during the handling, so it can be the preparedness. So good planning is very much required. That's why I told PP, plan and then prepare, and then you have to mock practice to do. Once you have done all the mock practices or the simulation practices, go for the performing your activities, action to take. So, and then resource budget allocation, it is very important. It is a neglected part. Most of the hospital owners are neglecting this part, don't want to put the good equipment in the functioning, working conditions, and then so for the, if anything occurs, that has to be then spillage kits, decontamination kits, radiation detection devices, protection devices. Very less budget they keep usually. So this is the it should not be get neglected. So that's why, as a hospital manager or hospital facility owner, one should keep the appropriate budget allocation so that the radiation emergency preparedness will be kept in the high level, and so that there will be no risk. Comprehensive training program has to be get arranged for the staff training at the regular level. All the emergency protocols should be get taught them to, they have to practice with the simulation drills, and the simulation practices should be get conducted. So certainly the another part is which is required is the communication strategy. If anything, our internal communication should be get very clear with the emergency communication channels, and that has to be get checked regularly also. And the communication with the external agencies also has to be kept a very effective way. Develop a plan for the public information dissemination, manage the public address system, and manage the communication with the patient, family, and external stakeholders like the district administration or the state administration. Disaster services are there in the district level. So that through communication, if in case of anything accident has happened in the facility, so this communication facility also should be kept ready. The emergency protocol, immediate response, and the coordination of with the authority, both has to be get connected and should be kept ready for the implementation for part. Facility infrastructural modifications, if it is required, that has to be get done. Decontamination facility, decontamination room has to be get isolation room. These things wherever required has to be get provided. So that appropriate radiation protection can be get applied there. Radiation detection systems of the advanced radiation detection systems has to be get installed, and so that to be get checked in the regular manner. So this is the radiation emergency. Whenever we talk in the nuclear medicine, this is not the one-man job. It is the everyone. The main first is the nuclear medicine facility owner. Those who are saying in the term of AARB, that called as a licensee or the consentee. So who are the licensee and consentee? Hospital owner or the facility owner. Okay, they are the licensee. So certainly they are the responsible, and as per the Atomic Energy Act, the facility license holder is the responsible for any mishappening if it occurs. They will be the handling this emergency response team. The licensee, physician, radiation safety officer, physicist in nuclear medicine technologist, emergency medical health professionals, ancillary staffs, and security. All should be there in the team. And all should, in the cohesive way, they have to work. There should be the coordination between each one. Then only the emergency response team can work in the nuclear medicine. So, and this should be in the emergency plan. It has to be get prepared in the beginning and of the setting up of the facility. Nuclear medicine facility, when you design plan, that time only this has to be get planned and approved. These are the steps of emergency management, and certainly there is the prevention, mitigation, preparedness, response, and recovery. These are the steps which we follow for the radiation emergency management. Licensee, the hospital owner or the facility owners are prepared the emergency preparedness plan for the facility with the emergency response team. And it should be get included in the radiation safety manual. So this is the part of, because this is the, when the facility is going to commission, the AARB doesn't give the permission without the seeing that they are there radiation emergency preparedness plan. How you are going to mitigate that if anything occurs wrong. Without that facility, you will not get the permission to run the department. Commissioning approval will not come. So that's why this should be the beginning only has to be done in the proper way, proper fund allocation to do, and the proper instrument, devices, facility, whatever it is required for that has to be get provided so that very smoothly the department can run. Emergency response team personnel to be get identified and regular exercises to remain ready for emergency response action. In case of any spillage of radioactivity, residual, it can be the fixed type of contamination, then decontamination will not exceed the level. There is the level given by the AARB. Different levels are there for the different zones. Like it is called as a public area. The areas are divided into three parts, called as a public area, supervised area, and controlled area. Controlled area are the hot lab of the radiopharmacy laboratories, where the maximum amount of radioactive material are going to get prepared. Radiopharmaceuticals get prepared and distributed and dispensed. So that is called as a hot lab, where the radionuclide generators and those things have been kept. So reporting anything emergency should be reporting should be done by the licensee. So licensee is the responsible to the competent authority. Competent authority is the AARB, and that should be done if any incidents occurs within 24 hours of the event of the any unusual occurrence has to be get communicated to the AARB. Either it can be the spillage of radioactive material inside the nuclear medicine department lab, or it's the loss, theft of the radioactive material, or it's the death of patient, or it's a therapeutic activity, especially not a small amount. The patient has death or anything happened inside the department during the isolation admission when the therapy treatment is going on that time, or the misadministration of radiopharmaceutical, or any other event which leads to the radiological consequences. These are the scenarios where the licensee is the responsible to report the incidents. And this reporting should be done in the AARB ELORA system. ELORA system is called as an e-licensing of radiation application. In the next slide, I will show you this. And this, once you have reported, it has to get follow-up report also to come from there. This is I was talking about e-licensing of radiation application, ELORA system. In this system, licensee has to be get and to be get apply, and the incidents to be reported in the portal. These are the portals: incident information report, where the date of incident, type of incident, what type of incident, which source was lost. All the information has to be get filled. This information can be get operated and the filled by the radiological safety officer, RSO. But this reporting will be done on behalf of that licensee only. So licensee is the responsible everywhere. Certainly, these are the parts one should know very clearly before setting up of the department that the hospital owners are responsible. So this is the expected or radiation exposure. If anything is lost or these type of things are there, police authority has to be get, or the lost source has to be get, nearest police station is has to be get, FIR has to be informed, and FIR has to be get lost. This is called incident information report, and this has to be, once it is done, so you have to attach the different or police complaint report and other reports as an attachment, and it has to go for, they will give the identification number for this, and update report they will ask, detailed report they will ask, and then report has to be get updated with the video clips or the evidence with all the visual or the video or the photographs. That has to be get updated, and undertaking should be given, and then that will be submitted. So this is the reporting about the incidents report in the ELORA portal system. I think this is the after the once you have reported, the investigation will start from the ARB, and they will give the radiation report investigation report. That they will go to the detailed report last. That they will go to the inquiry. That is also going through the portal. If it is required, then only the physical inspection for the any person or their nominee will come to for the report to see. Otherwise, they will do on the ELORA system only. And RSO has to be get in between the licensee and the ARB. The RSO will be the mediator person who can do this. This emergency preparedness plan, once we are talking, we have to talk with the feasible standing operating procedure. In the beginning only we have to document it and clearly to mention all the operational control procedures, display the emergency work instructions in the work area for the continuous quality improvement. So this has to be get done. If any procedure or new procedure are changing, that has to be get done. Radiation monitoring and the measuring instruments in the working conditions quality has to be get done. Adequate responders ready to tackle the situations has to be get done properly. Proper inventory of the radioisotopes to be get received, used, and disposed safely and securely. Decontamination kit should be get arranged, emergency cart, handy and easily accessible in the department. So clear-cut implementation mechanism, incident reporting mechanism should be get documented in the radiation safety manuals also. So these are good communication system, whatever. I am not going about this. This is the separate section where we can take in the next time, anytime. This is called medical emergency for the hospital readiness to check. I am just now, today's talk is related to only nuclear medicine inside the premises. What are the radiations emergency can occur? What are the radiation protection we have to take? If anything occurs to the patient or patient have in the risky, then that time we have to admit, or any disaster happens. That time hospitals should be ready to handle the radiation medical emergency for those victims. So this is the also one of the part where the hospital should be get ready actually. So this is the comes under the medical emergency, hospital medical emergency system. So there also has to be get trial system, decontamination procedure, ward, this thing, hospital readiness has to be get checked. That I am not covering today's lecture. So there are the operational control procedure for the radioactivity management and radioactivity contamination, which are the causes. It can cause the external or the internal. In the work surfaces is the external type of surfaces. Different type of surfaces can get contaminated. It can be in the body, skin, or contamination. It can cause from the skin absorption or by injection and inhalation. It can cause internal contamination. It can cause the loose type of contamination, or it can be the fixed type of contamination. If it is the loose type of contamination, decontamination process, all the steps are different for the loose or fixed type of contamination. That another is the misadministration. These are the radiation emergency scenario which can occur. So these are the different surfaces which can get contaminated, like plastic surfaces, tiles, PVC, which is, so mostly the PVC flooring should be there in the lab. So this can be get contaminated. Like stainless steel, clothes, skin. So we have to have the detecting measuring instruments, decontamination kit, spill management, and the non-radiation equipments also should be there. So these are the different monitoring instruments that are called as gamma ray spectrometer for the sample measurement of the radioactivity to see how much radiation is available in the sample, like different contaminated samples. Or it can be used for the in vitro experiments also. These are called gamma ray spectrometer. This is the emergency kit where we have to keep ready. Without this also, the committee approval ARB doesn't give to start the department. All that patient care has to do whenever if it occurs. So we have to place in case of contamination, patient should not move. We have to clean it, and the spreading should be get avoided. So these are the techniques. I am not going to detail of this, but we have to understand that what are the things we have to do. Monitoring has to be get done before and after. When the contamination is caused, one has to monitor that. This is the part of the radiation safety officer or their nominee by the person, the technologist or the physicist, whoever is available can do the monitoring and has to be get recorded. And everything should be get recorded and keep in the further report. So monitoring is also part for the any type of contamination or spillage if it occurs. So I'm not going the technical part of this in the detail of this, just I'm giving that what we have to do. So any radioactive sources are there, like has to be get kept in the sealed sources and should be in the closed room, lock and key. This way it's called as a security arrangement. So security arrangement can be done, the access can be get controlled by the biometric system also where we are storing. Or the lock should be, the storage of the radioactivity should be in the lock and key with the, so because security is also very important of the radioactive materials whenever you are using. So different type of contamination can be fixed type or loose type, external or internal, hard surface or the skin surfaces. So there are different type of decontamination kit, which I have shown in the photograph. These are the soap solution, shampoo, different type of chemicals are required depending on the radio or pharmaceutical chemicals, absorbent sheets, tissue papers, gloves, long tongues. These are the different materials are there. Potassium perchlorate, the stable iodine. If it is ingested, we have immediately to give so that the thyroid can be get blocked. So it is called a thyroid blocking agent. So that has to be get those type of chemicals also should keep for decontaminating like DMSA or TTPA type of gelating agents. That has to be also to keep for the clearing the faster the radioactive material if it has gone to the person or their patient helper, those who are there or their patient party. So they have suppose ingested by mistake or misadministration happen. So certainly the DTPA or DMSA type of chelating agent has to be get administered so that their radioactivity will go over faster. And that way we are decontaminating the persons. These are the surface decontamination. I'm not going for this. This is the cleaning process from outside to inside to do. This is the process. So just to get aware that yes, the people will do, the technical people will do that all the decontamination procedure during that, and the radiation safety officer under their supervision only it has to be get done. So this part has to be all the surface decontamination procedure or the spill management has to be get done. I'm not covering this part in detail. Okay, the external surfaces, if it is body is contaminated of the person, those are the professional or the patient party or the other general public, they have to take bath. Okay, and so for that in the nuclear medicine, we keep as a decontamination room as a shower system. So there we have to change the cloth and to tell them to take the bath 3-4 times with the mild soap, no alkali soaps. Okay, and with the shampoo, and if it is the nail or hair is there, that has to get cut. And then that way the personal contamination has to be get managed. After that, workplace monitoring and the personal monitoring is a very important part. This has to be get done by the radiological safety officer, RSO only. So it has to be get declare that workplace is now safe for the work. Okay, and the person who has got contaminated, that also should be get monitored with the personal monitoring devices like ionization chamber or the survey meter can be get used. So different areas, different type of limits are there. This is what we follow. Based on that, we are saying that the work area which is monitored is safe or not. Basic to remember is the whenever the spill or contaminations occur, this confinement and containment is the basic principle which we use. It should not get spread. It should remain contained in the area. That is the basic principles we add always for handling of the radioactive material. So confinement and containment is the basic things for the handling of the any radioactive material to make ourselves safe. Misadministration With that, wrong dose to the wrong patient, as I already said, and to the wrong route of the administration. Suppose patient is for the bone scan and it is given the oral administration was given. So certainly it will be called as a misadministration. So that patient, and that is also there, if the radiopharmaceutical is more than 50% of the prescribed dose. If it is more than that, then only it should be considered for the misadministration. In case of diagnostic procedure, if it is a therapeutic procedure, then if from the prescribed dose, if it is plus or minus 10%, if it is more than 10%, mostly less is okay, no problem, because that will give the quality will go down, but you will be get compromised. But if it is more than that, it is called comes under the misadministration. So that's always documentation has to be get done. How much dose is administered to the patient? Different scenarios is there actually for management of nuclear medicine. So don't be panic in case of anything happens. First, if we are following the radiation safety basic principles, nothing will happen. But still, there are the chances. Errors are there. It can be the instrumental error, it can be the human error, any type of error. But anything occur untoward event, don't be panic. Follow the standard guideline or work instructions. So these are the things we have to give the instruction to our staff also, always in the training. Don't get panic. You have to get handled immediately to call radiation safety officer or their senior supervisors, whoever are there, and that can be done, and follow the work instruction in the lab, which already is so far that the regular training also should be given to all the staff. In that, there are the different procedures further in the case of loss of radioactivity source that has to be find out, and that is also one of the emergency scenario. So these are the different hospital premises sources can be get lost. So we have to install the security camera. The logbook has to be get checked. Regular checking of the inventory should be get done. If shipment is lost, that also can be the emergency scenario. If the fire occurs, so certainly the radioactive laboratory, if the fire occurs, then basic thing, basic principles are used, but main thing is whenever it in the fire is in the flow of the full, because the electrical, radiochemical, everything is there in the lab. So best is the dry chemical powder to be get preferred always, and that type of extinguisher always to keep in the premises of your nuclear medicine laboratory. That has to be get installed without any compromise, always to keep. Alarm system also should work. So points to remember, what has to be here? All the legislation Atomic Energy Act, which is mentioned in there for the setting up of the facility, should be aware. All the hospital owners should be aware about the legislation, all the regulations, all the codes of practices, because there are the detailed requirements are mentioned in there, the protection rules, and then safety codes and guides are given in the codes of practices. So AERB is like gives different type of codes, and that this is like nuclear medicine facility safety code. Okay, so nuclear medicine facility to understand the requirement of nuclear medicine. This has to be at all the hospital owner, facility owner must go through this type of booklet before setting up of the department. Okay, which will help to cooperate with the radiation safety. Otherwise, radiation safety officer will ask something and then feel that it is the extra burden, extra budget, extra thing, and then it looks like that it get delayed, the project get delayed, and then it will cause the difficult things also, and the commissioning will get so much of delay, and it will affect your project. So that has to be the chairman. AERB is the competent authority for the anything to see in the inside our India as a regulated competent authority. We should know about that competent authority, the chairman of Atomic Energy Regulatory Board in Mumbai. Website is aerb.gov.in. I will just suggest everyone to go through that whenever you are planning for the nuclear medicine facility to get it set up. In the AERB looks for the all radiology, radiotherapy, nuclear medicine of the medical installations, all. Even the irradiation, sterilization, everything comes under that. But I am talking about the nuclear medicine only. So that's what it is. This site also will have the nuclear medicine facility there. If it is a reactor or a cyclotron or production facility, in that case, the BARC is the center actually, who are the producing the radioisotope. So we don't have to get confused with the BRIC. It is the sister organization of the BARC. They are the actually supply the radioisotope in the regular supply, service consultancy, and the disposal of disused sources and or the any unregistered sources done by the Board of Radiation and Isotope Technology. This is the Government of India unit in the Mumbai, and they have the main unit. They have the 6 more regional centers in the like Hyderabad, Guwahati, Delhi, Chennai. Like no, this they have the different centers and Kolkata. So they have the different centers, and that is also Bangalore is there one of the center. Okay, so centers are having main center is in the Mumbai, who is mostly these are the marketing of the radioisotopes, selling the market. They have the authorized for this. Okay, otherwise radioactivity cannot be get sold. So for this is the website which can be helpful for anyone, and one should know for which organization to contact when. This is I was telling the incidents reporting and investigation, ARB ELORA system must to know, and that has to be get implemented. There are the different documents are there. One has to go for nuclear medicine. ARB made so revised in 2011. That is implemented currently. Radiological emergency preparedness for the safety guides are there, and that has to be get. That will give you the complete information about the safety guidelines. Transportation of radioactive material. That is another safety codes are there. Transport safety guides are also given. Classification of seal sources. Mostly radiotherapy use the seal sources for the cobalt, like cobalt 60. And there are the they have the different brachytherapy procedures also. For that, the seal sources they use, like iridium. So this is the nothing but radiation emergency preparedness is the teamwork. So it has to be a team with the where the licensee is the one of the team leader, you can say, and then the RSO is the secretary for that. Usually for this team comes, and they are the like facilitator. So RSO works as a facilitator, and licensee is the only person is the team leader for this team radiation emergency preparedness team. So takeaway point is radiation emergency response plan before the commissioning and continue to follow strictly to inculcate the radiation safety culture in the facility organization. This is very, very important. Before commissioning only this all part has to be so that and should be get continued, should not get stopped just for the commissioning to take and then later on it has to be get stopped. Then again the problem will come. Because then it will not be happening, so many incidences will start happening in the department, and it will cause the regular activity will get hampered. So certainly it has to be get taken care by the licensee, hospital owner, or the facility owner, who is the licensee of this facility. Good radiation safety practices are the key of the radiation emergency preparedness. Practice the protection of 4P and 2E, the protection of patient, public, professional products, and 2E for the equipment and environment. Radiation safety cardinal principle, time, distance, shielding. Not only that, is the amount of activity. That will be the nuclear medicine it comes. So TDS in addition of the TDS, that the amount of activity to be considered as a good radiation safety practices. ICRP philosophy, justification, optimization, and limitations. ELARA has to be judiciously to apply as low as reasonably achievable. Effective radioactive spill management and decontamination techniques to be get implemented. Follow the zero tolerance policy for the misadministration in your facility. Regular refresher training to be conducted among the personnel and for the emergency response team. That means I want to say, handle the radiation with care, without any fear. If you have, with the care, if you have followed the good practices, nothing will happen, nothing to worry, everything will go smooth and it will be flourish. Thank you. Any questions if you have?
Thank you, Shivanand. It was an enlightening presentation. I thought that I went back to MBBS times when different subjects were taught and used to get inspired by some things in the presentation.
I know this subject is very new to actually people are not from nuclear medicine, but it is should be aware. Everyone should be get aware. Because the facility owner being and facility, because they will be the only responsible as a regulator.
Very simple, so it was easy to understand also.
As an auditor, suppose you are going to audit any department, then also you have to check. You should be aware of all these things. I have not covered many things here. I will maybe if I get the opportunity, I will see next time for the radiation protection or the planning, citing how the nuclear medicine to be get site planning of the nuclear medicine.
Thank you so much, sir. Thank you for spending time and for the session.